How does alcoholism affect your life? Part 1 of 6. Functional alcoholism. Can you function as an alcoholic? If you can drink whenever you feel like it, get up in the morning, make it to work on time, and get through the day without incident, does that mean you're not an alcoholic? The short answer is no. Alcoholics can continue to function as if everything is fine, at least for a limited period. Despite an addiction, they can work, go to school, or be active in their communities. For a time. The term functional alcoholic is common, but it can be misleading. If you're addicted to alcohol, you can appear to be functional. But it takes a lot of effort to keep up appearances and fulfill obligations. If you continue to drink, it's only a matter of time before you're no longer functional. Advertisement. Part 2 of 6. Signs and symptoms. Signs of alcoholism and symptoms of withdrawal. Alcoholism can creep up slowly. Maybe a few social drinks used to be enough, but at some point, a few aren't doing it anymore. The first sign may be a preoccupation with drinking. You may spend a lot of time planning your next chance to get a drink in your hand. Other signs of alcoholism include passing out, blacking out, or having memory problems, strained relationships, trouble maintaining responsibilities at work, hiding your drinking, getting defensive when confronted, or making excuses to drink, loss of interest in previously enjoyable activities, including eating. When you become physically dependent on alcohol, you'll likely have withdrawal symptoms when you stop drinking. Symptoms of withdrawal include shakes, nausea and vomiting, sweating, anxiety, headache. Severe withdrawal can cause confusion, delusions, and seizures. How much alcohol is too much? It depends on your size and gender. The National Institute for Alcohol Abuse and Alcoholism, NIAA, considers more than 4 drinks in a day or 14 inches a week to be a sign of excessive drinking in men. For women, drinking to excess means having more than 3 drinks in a single day or 7 each week. Part 3 of 6. Tests. Testing alcoholism. If you're a functional alcoholic, you may be doing everything you can to avoid the issue. You might even convince yourself that you're not an alcoholic at all. Maybe you just aren't sure. One way to test yourself is to stop drinking. If you begin to experience physical withdrawal, you may be an alcoholic. If you experience withdrawal symptoms, it may be time to see your doctor. The NIAA provides an alcohol use disorders identification test that you can take on your own. It's comprised of 26 yes or no questions. After you finish the test, you'll receive a score that may help indicate your alcohol dependence. This test asks questions like, have you ever been unable to remember part of the previous evening, even though your friends say you didn't pass out? Are you more in a hurry to get your first drink of the day than you used to be? Have you sometimes failed to keep promises you made to yourself about controlling or cutting down on your drinking? While these questions can help, there's no specific test to diagnose alcoholism. Although, certain medical conditions like pancreatitis or a poorly functioning liver can indicate to your doctor that you might be an alcoholic. Your doctor might assess several factors to diagnose alcoholism, including tolerance, withdrawal symptoms, ongoing desire for alcohol, spending a lot of time drinking or recovering from drinking, inability to control how much or how long you drink, giving up social or work-related activities, continuing to drink even in the face of physical and psychological problems. If you show a pattern of 3 or more of these factors in a year, you may meet the diagnostic criteria for alcoholism. Part 4 of 6. Progressive worsening. Functional alcoholism is temporary. Alcoholism is progressive. Alcoholism is a progressive disease. As time passes, your body becomes more dependent on alcohol and you need ever-increasing amounts to satisfy your body's demands. Without some effort to control it, it will continue to worsen until you can no longer function. Eventually, obvious health problems and behavioral changes will make your addiction impossible to hide. Even if you function well enough to fulfill your responsibilities, at some point, others will notice changes in your behavior and judgment. You'll be unable to mask physical signs like slurred speech and slowed reflexes. As the disease progresses, so does its physical toll. Alcoholism puts you at increased risk of damage to the central nervous system, cardiovascular disease, liver disease, pancreatitis, weakened immune system, some forms of cancer. Part 5 of 6. Effects on relationships. Functional alcoholism and family life. In addition to physical signs, alcoholism can cause issues with your social and family lives. Family issues, including marriage problems, are common with alcoholism. It's a lot easier to maintain the appearance of being functional outside the home than it is in an intimate relationship. To avoid suspicion, you may try to overcompensate or pull away, but the ripple effects can't be avoided. An alcoholic may need the spouse's cooperation in making excuses or providing cover for the outside world. The pressure of alcoholism is even greater if there are children in the home. One of the biggest problems for a spouse is getting their loved one to admit they have a problem and to seek treatment. Frequent arguments, suspicion, and lack of trust are common when one partner is alcohol dependent. The monetary cost of an ongoing alcohol problem can wreak havoc with family finances. Unfortunately, when alcohol is involved, escalating tensions are more apt to lead to violent behavior. In many cases, the spouse of an alcoholic may want to seek counseling on their own if necessary. Part 6 of 6. Getting help. Seeking help for alcoholism. Alcoholism is hard on spouses and other loved ones, but it's difficult to get someone to seek treatment, especially if they don't recognize the problem. For a person addicted to alcohol, deciding that they're ready for treatment is the first step. The next step is detoxification. Withdrawal from alcohol can cause severe physical symptoms. The withdrawal process should be done under medical supervision. If you're ready to beat addiction, you may find an inpatient recovery center in your area. Recovering from alcoholism is a lifetime commitment. In addition to medical help, you may benefit from the long-term support of behavioral or motivational therapy. Alcohol support groups can be very helpful in helping you maintain sobriety. Support groups can also help family members cope. Marriage counseling is also available to repair strained relationships.